because you will return, because muscles, once they've gained a certain length, want to keep that length, because we are creatures of habit.
Okay. So
Richard, sorry, can I just finish and then we'll come back? Otherwise, we could go a long way on that conversation. So I'll just finish and then we can come back. Now, so then I was interested, because it was actually a comment when I went to the Atlas Prophylax conference, and Vladimir, what's Vlad's surname? Tom, yes. Yeah. So Vlad made the suggestion, and he just over lunch he said, well, oh, what do you know, have you heard about this guy, Dr. Paolo Zamboni in Italy? And what he's finding is if he puts stents into the jugular veins, he's increasing the venous drainage, and he's treating MS, Parkinson's, Alzheimer's. Well, that's kind of not so far different from Brendan Stack. So I'm not trying to suggest that some of those concepts aren't wrong. What I'm trying to do is introduce concepts and saying, well, maybe, because when we look at Peck's work, where the head position changed just because they lowered the mandible, well, maybe if you prop the mandible up, and I've often thought we could do an experiment, I want to do an experiment, where we put bite blocks on people and watch to see if that changes their head posture. Well, if that did change their head posture, maybe it's changing the head postures, changing the internal jugular, because what Zamboni's doing is opening up the jugular, and he is curing MS for short periods of time in some patients, but not particularly statistically significant by some other researchers. But it's interesting, just like Brendan Stack. So now go back to that image I showed you earlier on of the constricted airway. Well, that whole weight of tongue is dropping back on that airway. Well, it's probably dropping back on the jugular. Probably dropping back even on the vagus nerve. And these are suddenly hitting me with all of these comments people are talking to me about vagal insufficiency. People are talking to me about, do you remember one of the lecturers at Brendan Stack's meeting was talking about a lack of, you know, the cranial strains leading to a lack of drainage of the base of the skull. So this venous, chronic, very similar, chronic cerebrospinal venous insufficiency. So maybe some strains are adding to the lack of ability to drain that, the skull, the brain. So the brain's sitting in there in this pooled blood that's not going anywhere, that's leading to all of these problems, and maybe literally tipping the head up slightly is opening the jugular, which would be approximately the correct time frame for Brendan Stack's results. Because that's the time frame you go through. I was watching with those cases. About the time frame, your blood drains out, you suddenly feel a bit better, it feels great. Now, I've been trying since, whenever I get a headache, which is very, very rare, but once since I've been thinking about this, tip my head back like that. Amazing, it just goes away. Maybe I have different headaches than other people, I don't know. But we really need to be thinking, we need to be considering it. And the most important thing is that these cases are not the ones with the most gross craniofacial dystrophy. These seem to be ones with the mild craniofacial dystrophy that are fighting it. And I try this myself, and maybe I'm onto something, I don't know. But if I put my tongue between my teeth and I push up to help hold my head up, because I think the tongue is that messing support of the head that's been lost because we had to breathe. But if I try and put it sideways up into my roof of my mouth, what I tend to find is I make a lot of cross-lateral strain that really closes down the airway and this area here. And of course, what they're really struggling to do is show good evidence of a change in the jugular flow, but I would imagine that's because they're lying everyone supine, putting them in a scanner. Well, they're never going to see a postural effect, are they? But this is interesting.
Michael, can I just say something? Do you remember dear Tom Craig from Glasgow, who was a therapist who died last year, or this year? I've seen several of these people who've had CCSVI work done, and they were sent by
Yeah.
They said that's why it's not working, it's a waste of time.
Yeah.
And you should, have your malafluent second first.
Give tongue space first.
Absolutely.
Just tongue space.
Yeah, yeah.
That's what we need to do. So as I was chatting earlier on with Doug, saying that there's so much more in orthodontics. I mean, when we look at sleep apnea, as I said, being significantly influenced in obesity, diabetes, cancer and cardiovascular disease. Well, here I'm suggesting maybe MS, Parkinson's, Alzheimer's, and we go back to Brendan, and we were talking about Tourette's and movement disorders, and of course TMD, and then scoliosis. I mean, maybe we're putting a lot together. A huge amount going together. Now, I want to be open-minded. I mean, it seems to me silly that no one properly scientific has gone around and looked at these strange anomalies and taken them seriously and tried to pull them all together. Am I really the first one to be going and trying to pull us all together? Can't be totally. But we need to work as a team. And of course, the comment I make to Brendan Stack, that I apparently came across a little bit pushy, but what I was saying is research. All we need to do, we're treating patients anyway at the moment. For minimal cost, we could gain the most comprehensive knowledge to date just by doing prospective, inclusive, comparative cohorts. Decide some parameters and get going. It's not difficult. We're all treating patients. Prospectively, get them all together, get them consented, everyone who can consent, because I don't think there's going to be much variation. I, in my paperwork, say, if you don't want to be part of my trial group, it's 20% more. And I've checked that with my insurance company, who said, yep, that's fine. Now, there's some things that are much more difficult to understand, like cranial osteopathy and craniosacral work. Well, what I'd really like to see is some better inter-operator agreement. Sorry, we have a room, one person goes in and analyses them, goes out, another person goes in, analyses, sits down and makes the same report. I want to have a look at that. Then I'm going to take it much more seriously. There is certainly something in it. John Silverstone, works wonders for me when I have a problem. But how much in it? I want to know. I want scientifically to know. And I want people to come up here and put up a watertight etiology and pathology in the way I've done today for you to pick apart. I've videoed it. It's going to be online. I believe in open science. Information should be for free. My time's not. I'll charge my time, but all the information I do, everything I want to put out there, all these slides, everything, you want something, you can have it.